Hey guys, what's up? It's Stephanie. I am back today. I have another video for you guys today. As I had stated in my previous videos, I'm going to try to make these videos as often as I can, being that I do start PA school in a month. So I start PA school in August, and I know that once I start PA school, I'm going to be extremely busy. So I will still make videos for you guys, but now that I have free time until PA school, I will try to make as much videos as I can for you guys to help you guys out with interviews, applying to PA school, CASP, personal statement, etc. Just sharing my journey so you guys can learn about the mistakes I made and my experience. Alright, first off, I want to begin the video by thanking everybody who has subscribed to my channel. You guys are awesome. Everybody who has left comments below. Those comments motivate me to keep making videos for you guys, and emails that I get also from viewers that thank me because my videos have either motivated them or have helped them out. So that really makes me happy. And like I said in previous videos, I am making these videos for you guys because I want you guys to get accepted into PA school. I know that when I was applying to PA school, I looked everywhere online to ask for advice, to have questions answered, being that I was first generation and I didn't know how school worked, graduate schools worked, or applications, etc. So I learned everything by asking other PAs I work with, by other YouTubers that post on YouTube, and also forums on the internet. So I hope my videos are helpful for you guys. And if you're a new viewer, welcome to my channel. Like I've said it before, I'm a pre-PA student who was just accepted to PA school, so I'll be starting school this summer in August, so I'm extremely excited. So I'll be vlogging about the white coat ceremony, which I'm really excited. Also, it'll also be in August, and also my first day of PA school, so I am very excited. Alright, so now back to the video for today and the topic for the video for today. So I decided to make a video about what are the most frequently asked questions in a PA school interview. So that way, hopefully these questions will help you guys out to be prepared for them. I went to 4 interviews, and out of these 4 interviews, I remembered and I tried to pick out the questions that were most commonly asked. So this is what I will be discussing in this video. Basically how I answered them, the advice I give for you guys, etc. So if you are interested, keep watching, and I'll talk to you soon. Bye. So this video, I'm going to try to make it shorter. I know my past videos tend to be really long. I tend to rant a lot, and I'm really trying hard to work on that. I know it's really sometimes boring to just be sitting and watching a YouTube video for more than 10 minutes, so I'm working on that. I will try to make my videos a lot shorter and a lot more concise. So this video, I'm going to make it in a 2-part series, and today's going to be the first part. That way it's a lot shorter, like I said. Alright guys, so if you haven't seen my past videos, I really recommend this book. It's called How to Ace the Physician Assistant School Interview. This is what I used to study for my PA school interviews, and it really helped me out because the majority of the questions that were in here were actually asked. As you can see, I still even have the little paper tabs in here just to remind me of questions that I had trouble answering. But I really recommend this for you guys. It's a great book. You can get on Amazon. It's about, I think, 20 or 25 bucks. That's where I purchased it, and it really helped me out to how it says literally to ace my PA school interviews. So I really recommend these. Alright, so now to the most commonly asked questions that I had. So the first one was, of course, the most common one is, why do you want to become a physician assistant? Why do you want to become a PA and not a doctor, a nurse, a dentist, etc.? Why do you want to become a physician assistant? So how I answer this question is to first think about, you want to be able to persuade the interviewers, the admissions committee who is interviewing you, that you are the best applicant for their PA program, that you are the best individual to become a physician assistant. So how do you do this? You do this by basically talking about your prior experience, making sure that you list and make sure that you tell them that you fit all the requirements of what becoming a physician assistant is and what becoming a physician assistant entails. So like I said, that can be from your experience. So how I answered this question, and I started by stating my years of experience. So basically I told them that the reason why I want to become a physician assistant is that in the past 5 years that I've worked in the healthcare department, I've worked in a variety of healthcare settings. I work in the emergency room department, labor and delivery, surgery department, also psychiatric department, and most recently in an urgent care. I've really liked working in these numerous healthcare fields, but I feel that sometimes my position, sometimes working as either a registrar or front desk, and most recently a medical assistant, is limited because I want to be able to do more for patients. I want to be able to care for them, treat for them, be able to diagnose them, be able to educate them. And I feel that sometimes as a registrar, front desk, receptionist, medical assistant, I am not able to do that because my job is limited. It's very limited as to what I can do. And also, not only that, knowledge-wise, I don't have the proper knowledge to be sometimes able to answer simple questions that I have from patients asking me about their diagnosis. I can't answer those questions because I don't have the proper knowledge. So becoming a physician assistant is going to allow me to obtain that medical knowledge, to be able to do more for my patients, be able to treat them, diagnose them, educate them, which is something that's really important, is educating your patients. And I listed an example. I work in the emergency room department in downtown San Antonio. The majority of the population in San Antonio is Hispanic, so the majority of the population that I work with downtown suffer from diabetes. And it was interesting because the majority of them had type 2 diabetes, but they didn't know, they weren't educated on what type 2 diabetes is, how they can prevent it, how to control it. And this is why they kept returning back to the ER with these issues with legs having to be amputated because they didn't take the prescriptions, etc. So sometimes, they would ask me a question about their diagnosis, type 2 diabetes, and I didn't know how to answer those questions. I always had to get the physician, whether it was also a practitioner, a nurse practitioner, or a PA. So this is one of the examples I listed. So this is one of the reasons why I want to become a physician assistant. And then after that, I proceeded to talk more about my experience. So I stated how I enjoyed working in the healthcare field, being that I was able to work as a team with other fellow coworkers, being that there were nurses, ER technicians, radiologists, etc. I liked how we all worked together, and I also witnessed the collegial relationship that the physician had with the physician assistant. And this is another reason why I want to be able to work in the future as a physician assistant. I am a great team worker. I am able to work well in a team. So of course, try to state your strengths that you have, whether you are a good team player, whether you are a good leader. In my job, I was one of the individuals who had the most experience, so the majority of the time I trained them, or they would come to me when they had any questions about how to do certain procedures on the computer, whether it was admitting patients, transferring patients to other units, ICU, NICU, etc. So I also talked about my leadership skills. Also, how I was able to work under stressful situations, being that I did work in the emergency room. It's a very stressful situation, and how I was able to handle these stressful situations. So I also talked about this by answering these questions. So this was just one of the questions. Another question that I really had very asked oftenly was, how do you handle stress? And I remember at one of the schools, I was so nervous. I was extremely nervous to the point that one of the individuals who was interviewing me asked me, "Are you okay?" She's like, "It looks like you're gonna cry. I thought you were gonna break out cry." And I was about to go and get a box of tissues. And I apologized and I told her, I'm like, I'm so sorry, ma'am. I'm really nervous, to be honest with you. I really want to become a physician assistant, and this is one of the reasons why I become really nervous. And then once I answered her, she told me, how do you handle stressful situations? So, and right when I was getting up to leave out the door, because I was so nervous, and she asked me this question is, how do you handle stressful situations? So how did I answer this question? First off, I calmed down my nerves. I'm actually like getting all hot now thinking about the situation because it was so embarrassing. How I answered that question is that I started telling her that, as I had informed her before, I did work in an emergency room, and not only did I work in an emergency room, I worked overnight, and I was the only admissions individual for the entire hospital. So out of the entire hospital, there was only one person, that was myself, and I was in charge of registering patients, obtaining information, transferring patients like computer-wise to other floors, admitting them for surgery, every floor that was in the hospital, whether we had surgery, we had NICU, we had labor and delivery, of course the ER, ICU, so I was in charge of the entire hospital. And overnight sometimes, especially on weekends, because I worked weekends, we would get slammed. And I was the only individual registering all those patients. So the majority of the time, the situations were extremely stressful because you had doctors on the phone screaming at you to admit the patients because they weren't able to order certain medications for the patients, which is understandable, of course, especially in the ICU. That's time sensitive. So in these situations, I learned how to work under stressful situations. How I learned by being organized, and ensuring that everything was done in a timely manner. And this is really important because, like I said, I would give priority of a NICU baby versus an ER patient that came in for back pain. I would give priority of an ICU patient that was flown from a trauma center versus a labor and delivery patient who came in for swollen legs. So organization is really important, and this is how I answer the questions, is being organized. That's how I was able to handle these stressful situations, because I was able to do them in an efficient manner and a timely manner also. Also being able to work alongside with the nurses I work with were amazing. The ER technicians I work with were amazing, so they really helped me out. And this is how I answered the question. So I also told her that I know how stressful PA school is, but being from my past experience that I've had having to deal with stressful situations, I think I will be able to handle any stressful situation PA school may have for me. So this is how I answered the question. My advice for you to answer this question is to provide an example, like I did. It doesn't have to be work-wise, it can be in school. For example, if you took 24 hours one semester and you were working full-time, so just talk about how the situation was really stressful for you and how you were able to overcome this stressful situation. What you learned from these stressful situations and how this will help you in PA school, being that you know how demanding PA school can be and how there may be situations where it's really stressful. Okay, guys, so these were just two of the questions that I had that were very frequently asked. Is of course the most common one, which is going to be asked in every interview, is why do you want to become a physician assistant? Also, how do you handle stress, or tell me about a stressful situation that you encountered and how you handled it. So this is just how I answer these questions, my advice, my personal experience of how I answered them. Hopefully they help you guys out. Like I said before, it's really important to be prepared for these questions, because if you're if you're prepared for these questions, then you're gonna ace them and you will smash them. Thankfully, I was prepared for these questions, but I know sometimes nerves get to you, because that's what happened to me. But I was able to answer them, and I got accepted to PA school. And I got accepted to PA school from this interview I just talked about, of one of the individuals who sat in the admissions committee, who asked me how do I handle stress, because I was extremely nervous. So I mean, I got accepted to the school, so I'm really happy. So I hope my experiences help you guys out. Like I said, I'm here for anything. If you guys have any questions or any comments, just comment below. Shoot me an email. I will respond as soon as I can. And like I said, I will try to make these videos as often as I can because I want to help you guys out, get into PE school. Like I said, shoot me an email if you guys have a question about anything, because I was in your guys' shoes last year, and I know how nerve-wracking the whole application process is, getting those interviews, preparing for those interviews. I mean, it's a long process, but it's worth it in the end. Once you get that acceptance letter, it's just the best feeling ever, because all those years, all those hours of you studying overnight, having to work shifts to get all that healthcare and patient care experience, it's worth it, guys. It is worth it, I can tell you guys that. Alright guys, if you guys like my videos, give them a thumbs up. Subscribe to my channel. I will be making more videos and they will be shorter, I promise. Alright guys, I'll talk to you guys later. Bye.